All right, can everybody see my screen okay?
Yes.
Perfect. All right. So I'll just kind of start out. It was wonderful to hear everybody's different things that they've tried. And I just want to stress because people use words like hodgepodge or maybe they weren't doing as much as they thought they should. And I actually was so impressed with what people were already engaging in. And everything counts. It really does have incremental benefits. So I just was really happy to hear all of the different ways people are approaching their integrative care. When I think about integrative oncology, and I mentioned this when I introduced myself, really is what I think of as evidence-based care, not just what we're reading on the internet, but really how do we have a good evidence for everything that we heard in the introduction, mind-body practices, nutrition, lifestyle modifications, and how these are complementing our current cancer treatments. We're not trying to recommend treatments that don't include our conventional treatments, but really how we complement these to improve, maximize quality of life and our cancer outcomes. So again, just a general overview of what it is. And, when we think about this in the context of neuro-oncology, I think it's important because a lot of the studies have come from patients with breast cancer or prostate cancer, where there might be much different presenting symptoms and symptoms that happen because of treatment. We know there can be so many symptoms when patients initially present with a brain tumor, and can include everything from seizures, having difficulty with memory, speech, visual changes, difficulty with balance. And when we are doing the therapies, and we heard a little bit about these from the group today, surgery, radiation, or chemotherapy, we can cause further exacerbation of these symptoms, in addition to other symptoms like fatigue, headaches. And it's important to be aware that these are things that we really want to support with the integrative approaches. Even the medications that we're using to, for example, control seizures or steroids that we sometimes need to use, these can have side effects as well and really impact mood, quality of life. Steroids in particular, and I heard a couple people mention these, can have a lot of different effects that anything from muscle weakness or proximal muscles that make it more difficult to go upstairs or even stand up from a sitting position, having insomnia or mood disturbances. And for those of you who have been on steroids, I've heard so many different ways that these can impact our quality of life. So we really want to think about that in the context of what we're trying to support with integrative approaches. And there are so many things that we could be talking about throughout this course, and I'll be sharing the stage with some amazing speakers, including one of our nutritionists and our cognitive team. And we'll be going over mind-body approaches, movement, exercise, diet, and I will try to use the word nutrition or nourishment as much as possible, some supplements, and how we're going to be able to help manage some of our symptoms, including neurocognition and fatigue. And I'm going to start with mind body approaches, which I think is one of the most useful and often underutilized tools in our integrative medicine toolkit. And I was really happy to hear quite a few people mentioning mind body approaches, because usually when I'm talking to people, people are thinking about supplements and other things, but these are such an important tool that we have that can really have some amazing benefits, including improving some of the symptoms we have, like depression and anxiety, can actually help with improving cognition. And I heard a couple people mention that, but improving that functional connectivity, actually growing our brain volume. If we look at the brains of people who meditate, for example, versus people who don't, their brains can often look 10 or 20 years younger. And we see that benefit memory and concentration. We see it benefit fatigue and symptoms of chronic stress. And I'll just briefly talk about stress, because this is such an important part of where we see the benefit of the mind body practices. And I won't give a big physiology lesson, but just to say that, stress is something that begins in our brain and really has an interplay between our brain and the adrenal glands and the rest of our body through our sympathetic nervous system. And this is really analogous to like pushing on the gas pedal of a car. We want to have a stress response when we, for example, need to jump out of the way of a car or we're in danger, but we want to be mindful that this is not a chronic process. And as I mentioned, we have this sort of interplay between our adrenal glands and stress. This can activate epinephrine and adrenaline. And if you think about all the side effects that we were talking about with steroids, adrenaline is very similar in how it impacts our body when we have it in our system for a long period of time. And usually when our threat passes, for example, we almost jump out of the way of a car or have another threat, this system kind of goes back into balance and we go back into what we call our rest and digest phase or our parasympathetic phase. And again, that's an important balance to have because if the cycle is not broken, we end up having chronic cortisol in our body, and our body stays in a heightened or revved up state on hyper alert. Some of my patients will describe, after they've been through their treatments, that they feel tired but wired, and they're really feeling revved up, and that's a result of some of this chronic cortisol. And when we think about cortisol, for example, with steroids, this can have anti-inflammatory benefits, and there are some good things to be considered. But when we think about it as chronically elevated, this can really suppress our immune system and lead to chronic inflammation. And I think so many of the strategies that we talk about with integrative approaches are in helping to decrease inflammation. This is something we know can lead to worsening of cancer outcomes. So it's an important thing for us to be thinking about and not having this cycle continue. And it can really cause worsening or when we think about cancer, but symptoms like GI issues and other things that can be impacted. So we really want to have this balance between our parasympathetic and sympathetic systems so that we avoid our body being on stress. And I'll just point out a couple of things that happens when we are in chronic stress, in addition to the ones I mentioned. Having higher blood sugar levels. We'll talk a lot, and Greta McCary will be leading our nutrition section about the importance of avoiding sugars. Having sugars elevated can be a result of stress as well. So this is something we want to keep in mind. So our mind-body approaches can really help with this. And this is by no means an exhaustive list, but some of the things under this umbrella can include things like body and breath awareness. And I heard some people talk about that, mindfulness, loving kindness, compassion-based meditations. We have movement or energy-based therapies, Tai Chi, yoga, Qigong, and lots of things that can be helpful in terms of being in nature, doing something artistic or creative. Those can all have a meditation or mindful mind-body benefit. And I'll just give a little background on some of these and the potential outcomes. And I'll start with mindfulness meditation, which is really the awareness that arises through paying attention to the purpose in the present moment. I love that they include the word non-judgmentally. And this is such an important part of mind, body, or mindfulness-based practices. Some of the benefits that we see are actual physiological outcomes like lowering cortisol. I just mentioned that chronic cortisol is not good for us for lots of different reasons, lowering inflammation and even increasing what I'll call good brain waves. And we have data to prove it. This was a study that looked at the ongoing effects of participation in a mindfulness-based program, and we actually see decreases in cortisol levels. And importantly, these levels continue to be decreased at 6 and 12-month follow-up. So we really see a sustainable impact on overall cortisol levels with a mind-body practice. This was a study showing just a 4-week mindfulness intervention, so not a lot of time. And these were not people that had been doing this for years and years. And we see lowering of these really important inflammatory markers, many of which have been studied and have been shown to be linked to causing cancer or worsening cancer outcomes. So we're actually seeing these lowered with a mindful practice. So really important to think about these physiologic implications. This was a study that looked at EEG results, and this was in 34 novice meditators, people that had never meditated before. And we see that they were having increased at these good brain waves, ones that were helping us feel more relaxed and calm. We're able to do better problem solving. So again, seeing this impact on the brain and these good outcomes. And for those of you who are sort of drawn to seeing things in real time, I will just mention a couple of tools my patients have used. One's called the Muse headband, which actually can show you what's happening to your brainwaves when you're doing meditation. They also have a part of the app where if you're getting to a more calm state, you can pick let's say you picked a jungle. That jungle will get quieter as you get more relaxed and into a better mindfulness state. So that can be really helpful for people to have that immediate feedback. Heart math is another tool that gives, again, this sort of real-time biofeedback that we used to need to do in the clinic, but now we have access to it with different apps. So just mentioning those. We also see some benefit on increased cerebral blood flow in parts of the brain that really help us with memory and attention. So this is helping to bring good nourishment and nutrients to those parts of the brain, helping with that neurocognition. Yoga, a couple people mentioned yoga, and I think it's such a fantastic approach to think about. And I'll just mention that there are so many different kinds of yoga. It is not or does not have to be the aerobic or acrobatic yoga that I think we commonly think of when people mention yoga. Many different kinds, and worth exploring to see if there's one that is a good match for you. We have laughter yoga at the Osher Center with our patients have absolutely loved. Things like restorative yoga, where we're focusing on breathing. We also offer that at the Osher Center. And we actually have an ongoing yoga class taught by one of our patients that Naomi and Mary will send out links for. So many different kinds of yoga. And even goat yoga, which I have yet to try, but I'm very curious. And I love having a goat join you in your yoga practice. And what are these benefits? So similar to what we saw in our mindfulness meditation studies, we see decreased inflammatory markers. We see decreased cortisol. We see decreased blood pressure, and we see decreases in our blood glucose. Again, we're trying not to eat glucose, have it be part of our diet. This is a wonderful side effect to really, benefiting our body, not just from a cancer perspective, but from other health aspects as well. And I put down here increase in the size of the hippocampus. For those of you who don't know, the hippocampus is a part of our brain that really helps control our memory and linked to some of our neurocognitive changes we see. So here's a practice that really can help with that as well in growing that important part of the brain. There are other movement-based approaches, including Tai Chi and Qigong. Tai Chi is a non-competitive, self-paced system of really this gentle physical exercise with having different postures that can flow from one to the next. It involves a focused, slow, as I said, movements that kind of flow from one to the other, and a lot of deep breathing. And that's a common theme throughout a lot of these mind-body practices. This is a wonderful thing that can actually be done outdoors. So if you're worried about being in a gym, there's a lot of different groups that will practice in outdoor settings. This is one in San Francisco, but this is worth exploring. Many of my patients who were kind of on the fence about this and tried it absolutely loved Tai Chi. Qigong is another practice that uses breath and meditation. It also can be done outdoors, and this is over in the Pacific Heights area where there's a group that meets on the weekends. So that's something to also consider. And we see, again, these wonderful benefits, decreasing stress and anxiety, improving focus, improving balance and flexibility. And Tai Chi and Qigong have actually been studied to improve balance and decrease falls. So that's something that that's a really nice benefit in, again, improving neurocognition and decreasing inflammation. A couple of people mentioned acupuncture, and there's so many receiving therapies. People mentioned Reiki, acupuncture, acupressure. I encourage you to explore these and see which ones really resonate with you. Acupuncture is covered by insurance, so I often encourage people to try this is an option with so many different benefits. We see benefits in fatigue, helping to lessen fatigue, improving sleep, reducing stress and anxiety, helping to improve mood. It can be helpful for pain and decreasing nausea. And we've also seen it even help some symptoms. So this was a patient who had a complication from surgery where the left eye was kept looking off to the left. And after one acupuncture session, this actually improved. So there can be some physiologic benefits related to movement as well. Massage is, and I wish massage was covered by insurance because we see so many benefits. It can actually lower cortisol and boost dopamine. It can improve sleep, improve immune function, decrease anxiety, and help with other symptoms. So this is another thing if you're able to bring this into your practice. You may find that as you're exploring these different strategies, you might say, okay, this is a time where I'm feeling like massage is going to be the best thing. But that may be something that you can rotate to acupuncture or try other things. These don't have to be things that you do all the time, every week, but to really try to incorporate them into your overall practice. And I'll just a couple of tips on meditation. One size does not fit all. So I encourage all of you to try different types, different voices. I put that because I really struggled when the Calm Out first came out. And there was a particular person who did most of the meditations, and her voice just drove me crazy. So I ended up really resonating with a speaker who had a Brooklyn accent, and I can't explain why that worked for me, but I just encourage you to try, different types of meditation. They do have walking meditations. It doesn't have to be that you're sitting still and in one space. I want you all to remember that we call it the practice of meditation. This means this is something that we are not going to be inherently good at when we get first started, but the practice of it is what helps us improve and really reap the benefits. It's okay to set smaller goals. Even one 15-minute session can actually help patients' outlook with negativity bias and be more positive. Many of the apps now are offering small meditations, 2 to 3 minute meditations. So it is okay to microdose, and doing one every day, even if it's a 2-minute meditation, is better than not doing one at all. I mentioned that being in nature, doing something artistic can also be a really good starting place. If we were to put probes on the brains of people that were doing a classic meditation, transcendental meditation, or doing something creative or in the outdoors, we're actually getting the same benefits. So those are okay things to try and can actually be a really nice starting place. Making sure that you have a space that you can do this and starting small and building up. If you have a timer, you could say, you know what, I'm going to dedicate 4 minutes today. And maybe the next day I'll do 7 minutes. And that can be a helpful way to just kind of build up to a goal that makes sense for you. Having a routine can be helpful. And the community. So if there's somebody that you can check in with and say, we're going to each meditate at the same time every morning, that can be a helpful thing, just like exercise, for example. But I think it's important, and this goes with all of the strategies we talk about, to be committed, but also be forgiving and compassionate and non-judgmental to yourself. I don't want patients to feel like they are failing or that they should be doing more than they are. We really want to have compassion on how we're incorporating these strategies into our daily lives, because it's not easy. It's not easy for anybody, and it's particularly not easy when you're going through a lot of different doctor's visits and all of those things. So be compassionate to yourself. I'll shift and just talk a little bit about exercise. We know that this is something that has benefited patients, even benefited survival, and this is why it's recommended by the American Cancer Society. Many of the studies that have looked at this have focused on patients who have breast cancer or prostate cancer or higher functioning patients. But we have seen studies in our patients with brain tumors, and we know that we see benefit across all of our patients. We see a lot of different benefits, including impact on stress and anxiety, helping to improve focus, improving balance and flexibility, cognition, and again, decreasing inflammation. So we see a lot of themes of these similar benefits throughout these different strategies. We see improved survival as well. And importantly, with all the studies that have looked at patients with brain tumors, there have been virtually no adverse effects. So you can do this. It might be that you're starting from a different place than where you were before surgery or treatment, but this is something that you can be able to do. And, you'll be building up to where you were over time. And I think that one of the things or myths that I always challenge is that the way that the brain works after surgery, whether it be differences in cognition or speech or even muscle movement, is modifiable. I think that there can be myths that these changes are permanent, and that's just not true. We have so many things that we can do to really help with increasing our neuroplasticity and really creating these connections again and getting, again, improvements in movement, improvements in neurocognition. And exercise has so many benefits on our patients and helping us do that. I had a patient who had a pretty significant foot drop after surgery, and it took about a year, but she was able to complete one of our ABTA runs last spring, and such a wonderful thing to see that improvement over time and that we can really regenerate and replasticize the brain. And one of the key mechanisms is by increasing something we call the brain-derived nootropic factor. This is something that can help with neuroplasticity and connectivity. It can help impact and grow the hippocampus. As I was mentioning, this is something that's such an important thing with our memory and neurocognitive function. It also helps with things like glucose uptake. It is, again, thinking about how our glucose is metabolized. And so lots of benefits just by increasing our BDNF. We see that we can see improvements within as little as 3 weekly sessions. So this is not something that you have to spend 2 hours a day doing to get the benefits. And in fact, one bout of exercise can actually increase BDNF, VEGF, good neurotransmitters, and our endocannabinoids, which are our feel-good molecules in our body. Exercise can also be really helpful for combating some of the symptoms of our therapy, including fatigue, which we commonly see during radiation treatment, but it certainly can happen at other places throughout the therapy. And part of this is by helping to make good, strong mitochondria. When we move, we actually make more mitochondria, and mitochondria are our energy powerhouses. So this actually helps us have more energy. The reverse of this is true as well. And if we don't move, we create more fragmented mitochondria. And this means that we don't produce as much or have as much mitochondria that helps with energy. And if you think about how hard it is to rebound after you've been in the hospital or maybe been sick, this is why we really lose these good, healthy mitochondria. So exercise helps us get them back. And yes, there's going to be days where it's really challenging to move. We just want to think about building up, step by step. Anything counts. We see exercise helpful for mood. It's probably the most underutilized antidepressant we have. Even 2.5 hours of moderate movement per week can reduce the risk of depression by 25%. It's pretty significant. And this was a trial that showed improvement in survival in patients who did 9 MET hours. And I'll talk about what that is in just a moment, but not a lot of exercise to really see this benefit on survival. So, and just to put it into context, what a MET is, it's thinking about the activity and the time. So something like walking slowly would have 2 METs, walking more quickly would have about 3. If you're jogging, we get up to almost 12. So our intensity of the types of movement that we're doing, it contributes to the overall activity level. And just 21 MET hours per week sounds like a lot. This is 7 hours of brisk walking. So really anything counts. And I don't know if I'm dating myself for how many people in the audience recognize Richard Simmons, but he was really onto something. It was just about moving the body, and he did Sweating to the Oldies, low impact. It was fun, and again, it all counts. It's you don't have to be going to the gym for multiple hours to get the benefits. I will just mention that your providers are okay with this. When we surveyed all of our neuro-oncologists, neurosurgery, and radiation oncology providers at UCSF, almost 100% felt that this was beneficial to patients, reduced treatment-related side effects, but only about 57% of our providers initiated a conversation about exercise. So just because they're not talking about it with you doesn't mean that they're not supportive of this. And if you ever have any questions, absolutely ask, but this is something that our team really is supportive and knows has benefit for our patients. I'm going to shift just briefly talking about sleep, because as we think about our different approaches, sometimes fatigue can be something that makes it more challenging to start something new. And certainly our therapies can contribute to fatigue, but not getting a night's sleep is also something that I think is very underlooked in terms of a cause of fatigue. So when we think about the prevalence in our cancer population, this is something that happens frequently, and can be related to anything from medications, particularly steroids, as most of you are probably familiar, and other factors. So these are just some of the sort of tips that I share with patients, and we'll talk about things that we may want to bring in that are, more if we have to do something more intensive. But these are things that you can try today, being mindful of our basic rhythm of life, establishing a regular bedtime, getting exposure to early morning light. There's been a ton of articles that have come out in the last few days about the impact of daylight savings. And I agree, this is a very stressful thing on our bodies, because we are really designed to be working within these sort of normal rhythms. Managing caffeine, nicotine, and alcohol. And sometimes caffeine can sneak in places like smoothies or other things. So just trying to be mindful of these and not having them too late in the day, or if you're very sensitive, even at all. Avoiding exercise too close to bedtime. This is something that can impact the ability to go to sleep, and it has to do with raising your core body temperature too close to bed. Some people can work out right around bedtime if that works for you, but this is something to consider. This is avoiding higher glycemic and harder to digest foods as bedtime snacks. So having a good glycemic index food can actually be really helpful. I've even had patients try MCT oil, which is medium chain triglycerides, to help keep our blood sugars even throughout the night. One of the reasons why people, after they drink alcohol, and end up having a good effect to fall asleep, but then are waking up in the middle of the night, it has to do with the high glycemic index, or having a big sugar spike, if you will, and then a crash. So other foods can certainly do that. This is something to explore if you find yourself waking up in the middle of the night. Having a healthy sleep environment. So ideally you want it to be a cool space, dark space, and they say it's so dark that you can't actually see your hand in front of you. If you need to do blackout curtains or other things to get it dark, those can be really helpful. And not having things in the room that remind you of things that you need to do, like unfolded laundry, or having your work next to the bed, trying to keep it as clean from those distractions as possible. For people, and we're so attached to our devices now, but blue light can really impact our ability to fall asleep and stay asleep. And that has to do with its impact on melatonin. So trying to stay off of those devices, not watching a movie in bed on the laptop. And even some people are really sensitive to the Kindles and other ways to read. They do make blue light blocking glasses, which can be really helpful, but don't discount the impact of blue light. In fact, I think that's one of the main things that has been helpful if we just try these sleep approaches. Blue light can be one of the easiest things to fix, and can really have a big impact. And then, as I mentioned, sometimes we need to think about doing something more intensive. cognitive behavioral therapy has been shown in many studies to have a benefit. And sometimes people also need to think about doing a sleep evaluation. Many of the physiologic trackers like the Whoop or Aura Ring or things like that are tracking sleep. So that can actually be a good beginning phase to say, oh, okay, I may need to think about what's happening with my sleep, but there can be different reasons why people benefit from having a sleep evaluation if none of these things are helping to get a good night's sleep. I'm not going to talk too much about nutrition because our wonderful nutritionist Greta McCare is going to go in detail over a lot of different things that people are really curious about with nutrition and diet. I will briefly just mention, because I know this question comes up, this kind of where we stand with thinking about our ketogenic versus our whole food plant-based approach. And I just wanted to, she's talking through all of the benefits for you all to keep this slide in mind that with our ketogenic diet, one of the main things that we see benefit in is decreased glucose, decreasing insulin, and decreasing inflammation, which is fantastic. But if we do a whole foods plant-based approach, we can get these same benefits and get the benefits of increased fiber, increase in our phytochemicals or flavonoids, which are actually anti-cancer, increasing butyrate, which helps with the integrity of our gut. And so many benefits that we see in addition to these other ones. So she'll be talking a lot more about that, but I just wanted to show this. And this, as we, again, think about sugars and how these are important to not only avoid, but also think about what's happening in our bodies when we're exposed to different sugars, or as I mentioned earlier, stress. This was a study that compared two groups, one of which underwent a very intensive fasting approach where they did not eat for 3 days and then went into a keto-based approach all the way through a 2-week course of radiation compared to people that just ate a regular whole foods plant-based approach. And we really didn't see any difference in these two studies. But what did come out as a difference is patients who had an average glucose of around 84. So, the approach that we get to seems to be less relevant than how we are keeping track of our glucose levels. And, it's not as simple as avoiding sugar, things that have high glycemic index. For example, a potato has this or impacts our body in the same way as a spoonful of sugar. And people have a lot of individual differences in how they respond to different foods. And as I said, even stress can spike our sugar levels. So as she gets ready to talk a lot about this in the part 2 session, just keeping these things in mind. I will also just say that there's cautions if you are doing a keto-based approach, making sure that you are doing this with the support of a healthcare provider. You can have higher levels of different uric acid accumulation, kidney stones. And so we want to really make sure that we're monitoring ourselves and not doing this on our own if we're doing a keto approach. Greta McCare is also going to be talking about supplements. I'm just going to give a little overview in starting with just a warning that we want to be very careful about interactions with supplements. So some things we want to think about in our neuro-oncology space, making sure that we're not doing or taking natural products that have antioxidant properties, particularly during radiation. Radiation is actually designed to increase free radicals at the site of the tumor. So we don't want to be taking high doses of vitamin C or mega doses of supplements that could be really decreasing those free radicals. The term I would use is mega doses. I am absolutely okay with my patients having a handful of blueberries or other foods that may have antioxidant properties. I just want to be mindful or caution against things that might have 2,000% of the daily recommendation, these mega doses. Many of our supplements can act as anticoagulants. And so we want to be careful if we're ever preparing for surgery or if we're taking an anticoagulant that we are mindful of this. And this list is actually quite long. Vitamin E our omega-3 supplements. Many of the different supplements can have anticoagulant effects, so we want to be mindful of that. We also want to be mindful of supplements that can interact or stimulate the immune system, particularly if you're on an immunotherapy or systemic therapy that's also working to impact the immune system. And again, these are just general cautions to be aware of, thinking about different interactions. It's also important to make sure that our supplements have what they say they have in them and don't have things we don't want in them. And it's kind of amazing how this is not as regulated as ideally as we would want it to be through the FDA. That's a different discussion that I don't want to take us too far off track, but a couple of websites that can be really helpful are the USP website and consumerlab.com. They will vet products, and I really like Consumer Lab. For example, you can go and look up, let's say you want to find a different vitamin D supplement, and it will show you a list of, close to 20 or more that are approved. And this can be helpful for cost maintenance as well, so that you're not just having to buy the most expensive brands of supplements. They will show everything. For calcium, for example, they have the Bayer brand, or with a lot of supplements, they vetted the Kirkland brand, which is the Costco brand. So this is a really good website to vet product quality, and again, making sure it has what it says and doesn't have things we don't want. And those things we don't want can include everything from mercury, lead. They will also test different food products. So they tested flaxseed a few months ago, found some of the common brands of flaxseed actually had levels of arsenic in them. So this is a good website to kind of make sure that what you're taking is actually safe to use. And again, Greta will go over some of these, but I'll just tell you some of my personal favorites. Vitamin D, I can't tell you how many patients who I've tested have low vitamin D in the Bay Area. This is something we know has good benefits, not just with cancer, but with all kinds of diseases. Boswellia has anti-inflammatory properties. So when we think about inflammation in the brain, Boswellia is an excellent anti-inflammatory. Melatonin can be very beneficial for sleep. THC or CBD combinations have not, we in our integrative oncology practice, we're not supporting them at high doses for anti-cancer benefit, but we do see a lot of benefit for side effects. And I just mentioned that because I know a lot of patients will come in and ask about the Rick-Simpson doses and these very high doses of THC, which often can be so difficult for people to tolerate. And, this is coming from Donald Abrams, who is one of the foremost researchers in THC for medicinal purposes. We see benefit for symptoms, but not recommending these very high doses. We just don't have the data that fully supports this yet. Phosphatidylserine is something that helps support our nerve cell membranes and may actually reverse some of the structural things that we see with aging, brain fog. It can help improve memory and attention. Acetylcholine can decrease neuroinflammation and have impact on some of our longevity genes. So these are a couple that I am interested in specifically for our neuro-oncology patients. I'll just mention, because it can be very daunting to think about what THC CBD products are helpful for different symptoms. And, I'll often have patients who a family member will bring over edible and they'll take it and they'll have 2 days where they were just really out of it. And there is a little bit of an art to thinking about what different brands, doses, types there are. So I will often refer patients to bhercules.com. And this is their website. These are UCSF trained pharmacists who are really thinking about how do we use THC CBD as medicine and to help with symptoms. And this can be a really great resource for patients who are looking for a little bit of guidance on how to find, again, these supplements, brands, dose, all of those things. I mentioned Boswellia. This is, again, a really interesting supplement. This was a study that looked at patients who were needing to take either steroids or something for inflammation. And we really saw that this helped decrease steroids, either patients not needing to take steroids or having much less of a dose of steroids they needed to take. So this is something that can be really helpful and beneficial for brain inflammation. I'll just briefly mention when I think about future areas, the power of our microbiome. And so when we're talking about nutrition and, all of those the components, exercise, interestingly, even mindfulness is impacting our microbiome. This is something that is helping to support our immune system, helping, with all kinds of different psychological aspects like mood, and we're learning that it also is impacting cancer outcomes. So a lot of these strategies are helping to support a good, healthy microbiome. And I think this is a really interesting area coming down the pipelines. And the other area, and I kind of alluded to this, was just, how we're thinking about individual differences in sugar. So if I had a magic wand, I would put a continuous glucose monitor or be looking at our sugars in our patients much more frequently than once a year, because we just see so many individual differences. Somebody can take or eat a couple of grapes and it will spike their sugar, and another person, it doesn't impact their sugar levels at all. So these are things that I think are going to be interesting, and hopefully we can bring to our patients, make that more accessible. In terms of resources for you all, at the Osher Center, we have fabulous acupuncturists, yoga, exercise counseling. We have a wonderful dietitian. The Cancer Center also has a great group of nutritionists and dietitians. And our integrative oncologists, and also our group visits that are for both integrative oncology, but now we have a lot that are one that's focused on diet and nutrition, one that's focused on forest or nature bathing. So please check out some of those group visit offerings. Through our survivorship program, they have the meditation that's been a wonderful thing for patients. As I mentioned, the yoga that's led by one of our patients, exercise classes that are offered on an ongoing basis, and of course, our integrative approaches course. So I will stop sharing and open it up for questions. And I apologize, just for the recording's sake, we wanted to get through all of that, but I know that there's probably questions that are coming from all different parts of this. So happy to answer any questions.